Well, South Dakota now reporting 403 total deaths from the virus, and many of those families who lost loved ones do want to encourage people to take coronavirus seriously.
One of those people is a South Dakota doctor who lost both of his parents to the virus and now writes a weekly column to help folks through the pandemic. Angela Konecki explains.
Betty and Harold Dean were married for 76 years. Both were in the Westcoda Manor nursing home in Wessington Springs when the pandemic hit.
For probably, like I say, close to 6 months, we're completely free of the virus. They were screening people and testing people. And so they managed to keep the virus out of the facility even when we had an outbreak in the community.
Dr. Tom Dean has worked as a family practice physician in Wessington Springs for 42 years. He writes a column in the weekly local paper, True Dakotan, to try to guide people through the pandemic. But he was helpless when the virus infected his elderly parents.
The virus snuck in, and it just went wild. And before we knew it, about half the residents were infected. And what was not worse, but what made it especially difficult is a very large portion of the staff was also infected.
Dr. Dean says his 97-year-old mother's health was failing, and she may have died anyway. However, she did test positive for COVID-19. She died on September 26th. Dr. Dean didn't expect to lose his father 4 days later.
My dad, on the other hand, had just passed his 100th birthday and was clinically quite stable. He was confused and he was frail, of course, at age 100. But he was stable until the virus hit, and when it did, it hit very hard, and he went downhill in a hurry.
Dr. Dean continues to practice social distancing, hand washing, and mask wearing. He believes if people just kept one thing in mind, we could slow the spread of COVID-19.
I've said we all need to behave as though we know we have this virus, and we need to act as though we know we are the culprits, even though we think we're not. But if we act that way and we respect these very simple rules, it can be controlled. But we've not been very good at doing that so far.